How's it going? My name's CJ Shoemaker, and today we're going to be going through the breakdown of the baseball pitch, and we're going to put it into two phases of the movement, the late cocking phase and the acceleration phase. I'll assess joint range of motion, muscle strength, control, bony alignment, and just overall technique of the movement. To diagnose impairments and provide performance feedback, and just some things that you'll want to look out for as a coach if you are putting a kid or beginner through a throwing progression for baseball. So if I'm a coach and I have a athlete performing pitch for the first time or first couple times that they've ever done it, for the late cocking phase, you're going to want to observe shoulder abduction and external rotation, as well as trunk rotation and scapular retraction. However, you might notice several compensations, like the throwing arm externally rotating to about 145 degrees, which is below the normal range. Usually you want that to be about 160 to 180 degrees. There's a noticeable winging of the scapula. So when you're coming out here, you might be able to see the scapula wing out a little bit, and excessive lumbar lordosis are some of the things that you might look out for. For the manual assessment, you might see things like limited glenohumeral external rotation and tightness of the internal rotators, like the subscapularis and the pec major. Muscle tone in the serratus anterior and lower trap is reduced, likely contributing to the scapular winging that we were just talking about. And there's also going to be a limited or no anterior pelvic tilt at all, which may be due to poor core strength and control. For more of like a functional anatomy insight, some things that you're going to want to be looking for in the late cocking phase is in the rotator cuff and the scapula stabilizers. Those are going to work synergistically to create a stable base for torque generation, and without adequate scap control, the humeral head will translate anteriorly, risking labrum tear or rotator cuff injury. Another thing, if you have an athlete, the thoracic lumbar extension is, you're going to have a compensation for poor thoracic rotation and core weakness. And then you usually are going to give someone a performance rating. So if these things are going to be happening, usually that's out of 5. And that would give you maybe a base starter of around 2.5 out of 5. And yeah, so those are just some of the things that you're going to want to look out for the late cocking phase. And then next we're going to be talking about the acceleration phase. So for the acceleration phase, as you transition into that for your athlete, the plant foot, the lead plant foot is slightly closed off, and the trunk will start rotating before the lower body has even completed the movement, and sometimes even before that plant leg has hit the ground. Definitely you're going to see limited hip and shoulder separation. Like we said, that rotation of the upper body should happen before the lower body kind of follows with it. Usually you see it all kind of go at once. Arm is going to drop into the vertical angle too early with internal rotation. That's going to cause more strain on the shoulder and your pitch to be less able, you're going to be able to control that pitch a little less as far as accuracy goes. And yeah, so when you're throwing a little more high velocity, you start to see that. So that might be something that you're not too worried about, as if you're working with a kid or someone that's just beginning. You might see hip range of motion slightly restricted on the lead side, and glute max strength not be very optimal, which is going to cause you to have less control and less power throughout the whole movement, as well as that's going to minimize your trunk rotation sequencing. which then you will able to see if that trunk rotation sequencing is going to be lacking, because you'll see delayed oblique muscle activation if you're doing like a video analysis. And the efficiency of the acceleration phase is important because it requires max hip shoulder separation to build up that stored elastic energy to be able to throw a more powerful, more accelerated, more controlled pitch. Premature trunk rotation reduces energy transfer throughout the kinetic chain, placing more stress on the arm throughout the entire movement, not just the acceleration phase. A closed off plant foot, like we said, is going to misalign the pelvis as well, contributing to trunk compensation, which again, that's going to cause your arm to drag behind and put more strain on the pec major and your anterior delt and honestly everything throughout the shoulder. So closed plant foot, like we said, misaligns the pelvis, and that gives you that vertical arm angle, increasing anterior glenohumeral joint loading, which is something that we see in a lot of baseball athletes. So again, if you were looking at this and these were some of the things that were happening throughout the movement, again, that would be around a 2.5 out of 5 for their performance rating. So yeah, just to kind of wrap up, the diagnosis of impairments is going to be poor retraction and winging of the scap due to weak serratus anterior, and just honestly poor neuromuscular control. When someone hasn't done a movement, it's going to obviously be harder for them to have a repetitive action the entire time. Core instability, lumbar compensation, decreased hip and shoulder separation, inadequate glute and trunk engagement, going to be some of the main impairments that we see. To rank those in a priority, we'll probably put the scap control and the trunk stability as are your first priority, because that's where you see the most injuries occur when those things start to happen. Next would probably be the kinetic chain sequencing, because that just throws off your overall performance. And then probably third for the prioritized faults will be the hip range of motion and stride alignment, because that throws off your entire alignment and your whole energy transfer. So to correct these issues, you're going to want to implement a program focused on scapular stabilization drills and core activation exercises, as well as hip mobility work and throw pattern retraining, which that'll be reinforcing efficient sequencing using like medicine ball rotational throws, resisted trunk rotations, putting a band around the hip and trying to get that trunk to rotate, and then lead leg blocking drills. So trying to have something on the floor, piece of tape, whatever, that you're trying to get that lead foot out to, as well as still having good trunk rotation and focusing on not letting that arm drag behind. So in conclusion, some of the fundamental pitching mechanics might be there and able to be seen if you're looking at a beginner trying to do a pitching throw, but compensations and weakness are always going to be there in someone that's just beginning, or even someone that's starting to move on to a little bit more of an advanced level. Things that they've learned as a kid might start transferring through, and they're gonna, while it might be comfortable for them, it's still gonna be giving them some pain or some performance issues. So we're gonna wanna look at those weaknesses and key areas to lead more efficient throwing to reduce injury risk. And then with a targeted corrective strategy, you can optimize the biomechanics and enhance the performance and reduce the likelihood of just the overuse injuries that we see during someone throwing or playing baseball in general.